Good evening, morning. I don't know why I say all this, but good morning and good evening and good afternoon.
And again, third time's the charm. Welcome to DaBootyDoc Talk this evening. How are you all doing again? We're talking about a super important topic this month and this week because it's colorectal, as we reminded you last time.
Yes, everybody. Happy to be here. This is Dr. Shiraz, Sydney Farooq. We are here, and we're both here to talk about a very important thing. This is the month of March, and colorectal cancer awareness is the topic, is the hot button topic, White House. So people are talking about colorectal cancer all over because there are people in this country and the world.
Yes. So we've talked about colonoscopies a couple times, but what's the real issue here is that the age has required to get a colonoscopy, and that's very critical. Why, doctor?
Why? Because affecting at an earlier age. The age for colonoscopy screening, and I'm in that category. I'll be 50 next month, and I'm at age 50. However, now at age 45 is the new dogma where you have to get a colonoscopy.
That's right.
Because more and more prevalent, and we are seeing that happen again and again, and an alarming situation. So doctors all over, colorectal specialists, intestinal specialists are all talking about getting checked, get a colonoscopy, and take a look at your booty.
That's right.
The booty doc is here.
Either, because a lot of times people, when it's 50, they wait till they're 55, 45. So that means you shouldn't be waiting till you're 50. There's a reason it changed. It's because, like doctor said, so you need to be getting screened because the risk is high.
And we wanted to tell you this on the live DaBootyDoc Talk show.
For the first time, we started this show at the beginning of this year. We wanted to have, Conrad talked frankly about with your proctologist and discuss things like dinner table material. But
they are dinner table material, but they'll make you laugh a little bit. Talk about smelly farts. At my dinner table, we talk about it. About it when they were little. Do you know that I would tell them stories, and my little daughter, Laurel, used to tell us stories about poopy diarrhea. And it was very funny.
They reminded us that Dr. Farooq used to read them a book about elephant farts.
Yes, there was a book I was given in my fellowship, my colorectal surgery fellowship, about this book, and my daughters came up with the idea that Dad should write a book on poop. Interesting idea.
Has been done before.
Correct. So, talk that we have today for 30 minutes, we are going to provide some education for you, and hopefully that'll allow you to go to your doctor or your medical help and obtain better care for some things that you may. Yes. This is just an informational talk. We are not providing any medical advice. Please understand, disclaimer for this talk that we wanted to get it out of the way.
Yeah, so that's always the case, to share your information with your physician so that way they can best guide you. But problem to get a screening colonoscopy, it's screening for a reason. So you might think, I'm healthy, I grow my own food, I eat my chicken's eggs, but that doesn't mean that something dangerous going on.
Do you know a lot of people were worried about chicken eggs because Mexico chicken egg import into America, and the egg prices went up. Smuggling eggs across the border.
This is recently when the egg prices were going up.
Yes.
So.
It may be because our food is getting problematic. So
True.
we're realizing that our food products that we eat, and that may be a cause of some of this issue.
Yes. So that's a good point. So let's talk about the basics. What is the prevalence now of colonoscopy or rates, and why are we recommending colonoscopy for 45-year-olds?
Well, what we're realizing is that rates have gone up from 1995 to 2009 and above, and they've collected the prevalence of colorectal cancer has almost doubled in the younger population, and that's a very thought process. And what we're seeing is that up to 11% of people who are diagnosed with rectal and colon cancer, and this number has been put from a recent study that was done by various big, and that's an alarming number because we are seeing that colorectal cancer is being seen in a very young age, in the 30s and 40s, and so we are getting worried about this. And I want to bring this. I did a colonoscopy on a very young patient. You know, she was the same age, Maya, and 18. And at age 18, we are seeing a lot more pathology. I'm also seeing a lot of younger people, and I'm in discussions with other doctors across the country, and they're also patients in their offices knocking on the doors, having colonoscopies and finding cancer. So we as physicians are like, whoa, this is kind of alarming. So
study was done in 2009 as the completion date. That's, you know.
yeah, so the data are always behind. So the data is 10 years lagging.
Test group was going to be
exactly, and that's why we have brought that's a very big step, guys. 5 years difference from age 50. 45 is the new number where you get a colonoscopy, because this number shows us colorectal cancer in the population has jumped tremendously, and this is in younger population. So
what do you mean by left side of the colon?
Well, the colon the left side, and usually we were seeing a decrease in number of cancers on the left side, but now we are seeing a rise of cancers on the rectum and the left side also. Is showing that cancer is growing everywhere, and we
absolutely. And you know, colonoscopy, it is really it's not something to really be afraid of. It's scary, but
it is a scary procedure. There can be issues with the procedure itself, but it is mostly safe, mostly harmless. If I can use Douglas, if you guys know Douglas Adam, the Hitchhiker's Guide to the Galaxy, the life, the universe, and everything.
I was thinking medical here.
Yes. So the Earth he described mostly harmless. So that's why I brought it up for us. But colonoscopy is a safe procedure done by thousands of doctors, and it can be helpful because it can not only find, but you can also remove it. So that's very important, and that brings us to another associated with that is screening for tests and for this. And we also have you do on where you take a little bit of the poop and they can do a DNA test on it. And what they're finding is that it can find cancers, but the checking for polyps is not that good. It's less than 50%.
May show on a stool test that you have a cancer, but you might cancerous that aren't detected.
And the whole point is to find this cancer early. So you nip the evil in the bud.
cured
it's the
from it.
only cancer in the world, guys, if you remove it in the precancerous stage.
Right.
What this means is that you have a polyp, you cut it off at its base, and the polyp goes away.
So screening is very crucial because if you get the polyp removed, you have the cancer detected later on, and you follow up and do it again, usually in 5 to 3 years.
Pathology is. Do you know I'm getting a colonoscopy?
When?
Well, this is I'm getting my colonoscopy this month in 2 weeks. Look out for DaBootyDoc getting his colonoscopy.
So if you're one of our patients, then we called you because often why?
Yeah, doctor is undergoing anesthesia, and I'll be asleep, and I'll have a tube that'll go through my bottom and inside me, and pictures will be taken. Biopsies may be done. It's possible biopsies may be done if I have any polyps. Sometimes polyps can be found, and as we are discussing that polyps are found incidents now, I'm a little worried about it. You know, I've been eating American food for the last 20 years.
Does polyp mean cancer? Are all polyps cancerous?
Polyps are not cancerous, but there's a pathway where polyps turn into cancer. So polyps can become cancerous if they are abnormal in size. Look, genetic predisposition.
Polyps have genetic predispositions?
Yes, factors for colorectal cancer is such that if you have a certain risk of colorectal cancer is high. So amongst that are genes like or the Jordache gene. I have to go there because that's one of the
biological genes, not your Jordaches.
Or the Levi's. So is that there's a higher incidence of younger people with cancer, and that may be related to some genetic factors. So the genetic viewed right now, and they're finding that there's a slightly higher risk of colon cancer that is genetically linked in the younger population also. So family, your parents, your brothers or siblings, sisters, you should go and get a colonoscopy done because you may be genetically at a high colorectal cancer.
And use yourself as your family spokesperson. So if you're the brave one, maybe it will encourage your family members. You might be clean, but that doesn't else in your family doesn't have polyps lurking. So
and the genetics can be maybe clean, and the other may have the genetic problems. So it's so important to have this discussion at your dinner table. Mom, dad with colorectal cancer in the family, sister, brother, have you had a colonoscopy? And aunts, what's going on? So, you know, have this discussion amongst family members, and surprised that you may gain some information and help yourself.
That's right. Just follow what the guidelines say and go ahead and get a colonoscopy when you're 45. Have a family history. Maybe you're adopted or you don't know because your family just did.
Do you know the other risk factors for colorectal cancer?
No. Not necessarily.
I think people have some idea what is causing colorectal cancer in the environment and playing the risk. Okay? So what we are noticing is that obesity lifestyle is a big risk factor for cancer all over colorectal cancer. And when you are obese and when you have metabolic, that you are overweight and you are on the scale and you're bulging, deposits are turning your hormones and your testosterone and estrogens you, and they are causing your cells to abnormally grow. And that abnormal colon turns into colon cancer. So what we found out is that lazy and not working out a few minutes a day or something like that and getting heavier, your risk of colorectal cancer goes up. If you're drinking, okay, alcohol can aggravate that. If you eat and hot dogs and grilled charred dead meat that has been burnt a lot, then your chances of colorectal cancer. These foods are carcinogenic. Bacon and processed meats and hot dogs, etc., are cancerous or precancerous. So over time will lead to colorectal cancer and other cancer. Studied and found out. If you're not eating a lot of fruits and vegetables, fresh fruits, your risk of colorectal cancer goes up. You know another risk factor? Come on, that's my favorite one. You know what that is? It is.
I knew it.
Yes. So when you are not eating a lot of fiber, that is in contact with processed foods and other material for a long, it's in transit and not moving around, the cancer and toxins can then damage the lining of the intestines. But if you have that moves the food through your colon and cleans it every day, like then your risk of colorectal cancer may go down. So eating vegetables and extra fiber can help colorectal cancer and other cancers in the body.
Because when you think fiber is what you say it is, it's fibrous. So it's actually, as it's moving through your colon and picking up those particles or those bad bacteria or different things are unhealthy to the lining of the colon. And that acts as, we like say, like a scrub brush. If you want to do a real colon cleanse, eat lots of fiber, drink lots of fluids, and you out.
Carrot juice. What's up, Doc? That's another joke I thought of. You know Bugs Bunny, guys? I may be too old, but Bugs Bunny always had a carrot in his mouth. And he would. So eating fiber, fruits, vegetables, all of those things, healthier stuff is going to help.
So Bugs Bunny had a pretty clean colon.
It's possible. I don't know if you ever had a colonoscopy. He's more than 45 years old. Get a colonoscopy, please.
He is. That's for sure.
So I'll give you an example. Okay, who doesn't like fries? Fries are very delicious, I guess. So if you go to McDonald's, if you go to restaurant, Burger King, Chick-fil-A, Wendy's, all of them, cook fries at home. You're making them with oil, salt. Yes. Am I right? But when you go to any of these restaurants, you're adding on other processed ingredients. And fries have probably other elements in that fry. And what we're finding out is that chemicals are adding and causing us, and these patients who are eating processed foods are getting problems. So processed, they are quick, easy, in a can, in a plastic bag, microwavable, yes, all of that stuff. Oh my God. I don't know, it's possible. Processed foods are going to add higher risk for cancer. Cancer is one of these where we are seeing, because food gets in touch with the colon, it's there. I think microplastics have a big role to play also. You know, everything, you drink a Pepsi or a Coke or any soda, any alcoholic drink, and it's in a plastic wrap or bag, you heat it up or you keep it cold, it releases out microchemicals. And these microchemicals are affecting the human body.
The water from the tap.
I think there's microchemicals in there. too. We are. I think we're all going to get.
No.
I'm just being pragmatic that if the youth is, we are seeing colorectal cancer in our 30s and 40s, these people are going to have problems.
Well, that's why, because
Do
we don't want you to be doomed. You're not doomed. It's about educating yourself to take life, making that step to be conscious of your health, and being your own, tell you to go get a colonoscopy, and you're going to listen except for probably yourself.
And know that you have a problem. So now this is where you should pay attention. If you are bleeding, you wipe your butt and you see blood on the toilet paper. If you itching, burning, these are symptoms that could be associated with colorectal. Younger population, we are noticing that these symptoms may not be that easy to find symptoms.
What if I have like hemorrhoidal problems? Does that mean there's something else going on?
You need to go see a doctor and maybe get a colonoscopy at the same time when you get checked out. Colorectal cancer is increasing, so we need to figure out ways to help their colon at the same time.
If you see patients that are young are you recommending colonoscopies for them?
Nowadays, with the incidence of colorectal cancer, there's a higher likelihood that we are going to find some pathology. Certain populations where there are patients with genetic predisposition and of colorectal cancers and their symptoms, yes, sometimes we make recommendations for further diagnostic testing, including colonoscopies, including DNA testing.
So it might be wise if you have a 20-year-old, but that's for colorectal symptomology, that maybe they should get scoped.
I'll give you an example. I've seen people in my practice who come in with younger puppy, and then we look inside and we find something else. Mm-hmm. So yes, that is important to please look at some answers.
Now, also, what we're talking about sounds like every time we give someone a thing. So is that the case? Does every person have a polyp? Does some people come out clean?
There are lots of people that come out clean, and I think these are the very lucky ones, nicely, and they've had good genes and they have had better exposure. But if you're eating a lot of alcohol, if you're eating processed foods, if you're genetic predisposition, then I think you need to go have a talk with your doctor or your provider. Maybe I should get checked out.
Right.
Because prevention is the key to cure. Not only do you prevent by getting a checkup and getting colonoscopy, it also means that you take active steps to improve your health.
That's right.
And that's shake your booty a little bit, okay? Get to do some exercise, food. Don't eat so many processed meats and processed chemicals.
Okay, what about the guy that still has polyps? Anything right? Does that happen?
So there are patients that will be like that, and then from colonoscopy, and then they may require surgery, and they may require radiation or chemotherapy arm of colorectal cancer, and that will involve a specialty and providers who can help them.
So you find a polyp, you remove it, pathology comes back, it's not problematic. You tell them to follow up in 3 to 5 years, depending on the situation. What was I going to say? Lost my train of thought.
Anything else? Yes, we are. See, here's where I think we should go beyond that. We should tell them, look, we'll see you back in 3 to 5 years, but we should also educate them that in the next, these are the steps you have to do. You have to change the lifestyle at your early stage. maybe changing your diet, your habits, all of that will make a difference.
There's a difference between the screening colonoscopy and diagnostic colonoscopy. So symptoms, you meet the age criteria, you never had a colonoscopy before, you're just getting checked out. Like maybe you have bleeding or something going on, some sort of ailment or symptom, then diagnostic colonoscopy.
Correct.
So if I'm getting a diagnosis, the first time I find a polyp, 3 years later, I have, does that happen often? Are you always going to have recurrence of polyps?
So polyps can either grow back, or you can have a high risk of polyps forming. So the new data that's going to come out, I think in the next 3 to 5 years, is going to identify whether these patients need to be having repeat 5 years or for a longer period of time. The polyps that are totally benign, 10 years, and there are polyps where you need to see them back in a few months and remove it, etc. So there's a whole gamut of where patients and population will lie, and you will have to determine that based on their body habits, based on their disease, and based on their, that's because also male and females and African Americans and white.
When do I stop following up and having repeat colonoscopies? Now I'm 70.
75 years is the age of a cutoff for colorectal cancer, and
meaning you won't get it after that age, or you just don't screen for it because you're higher.
One factor, your chance of getting colorectal cancer is less if you've been 75 and you never had, still there. So in some cases, if you're healthier and if you're rectal bleeding, then a diagnostic colonoscopy can be done.
But the less likely you are as a physician to prescribe a colonoscopy for someone.
Correct.
Because they're more higher risk during the procedure.
Correct. So in the last 3 minutes that are left, guys, I wanted to go. Colorectal cancer is rising. Age has dropped. You want to say something about their diet?
Eat more.
Yes, guys, eat lots of fiber, less alcohol, less meats, and more fruits and vegetables.
I think of all the recommendations I've ever heard from a doctor, eating more fiber is probably the most simple thing that you can add. It has such a huge impact on your overall health. Fiber has other benefits to it, scrubbing your colon. So,
did I mention my favorite fiber yet? I mentioned it every flaxseed fiber. Okay,
right.
Because ground flaxseed has omega-3s, fibers like psyllium, psyllium husk has very little nutritional value. Flaxseed can be a very nutritious fiber to add in your diet. You can sprinkle it on your cereal, oatmeal, yogurt, smoothies, etc. So
the one thing I did want to ask is real quick, if I do have, does that mean cancer treatment, chemotherapy, surgery? Are there?
That's a talk for another time, which we will be talking about, but that is discussion about what the treatments are, how to deal with that, and we'll be about that, because I think the message for today is get checked.
But it might be an option.
Correct.
Without having to do chemo or things like that too.
Yes, they're available for you at that point.
Okay.
So guys, we are finishing up. This is Sydney Farooq, Shiraz Farooq, and Sydney Farooq. We are here at Colowell America. Colorectal cancer in younger adults and how and what. Please get checked, get a colonoscopy. We're out. Thank you so much.
Yeah, don't be educated about your health. So we'll talk to you soon. Let us know if you have any questions questions. We'll be back next week's topic. It'll probably be colorectal cancer related.
Yes, because this is the month of colorectal cancer, trying to do our best so that more and more people understand that this is a preventable.
That's right. So reach out, check out our social media, and we'll talk to you.
Take care. Thank you.